Hi everybody, my name is Sancho. I'm one of the intensive care consultants of King's College Hospital in London, and I would like to introduce you today a new technique in order to ventilate two potential patients with the same ventilator. This technique has been described in 2006 previously by two colleagues called Greg and Charlene from the Emergency Medicine Department in John Hospital Medical Center in Detroit. What we have done is to use a servo market ventilator, to use two TPs in the in and out arms, and we have put 4 microfilters on all of them. In that way we have two different systems for two different patients. We are using here at the moment a MBBCh technique, and as you can see, we have a 30% oxygen, 14 of PEEP, respiratory rate of 15, which we will increase because we're supposed to ventilate ARDS patients. So let's put, for example, 26. We have a ratio of 1:1. Times respiratory is 5. And we calculated tidal volume of 840. Please be aware 840 tidal volume is for 2 patients. So that will be about 420 to 400. Ideally will be for 2 patients with the same pathology, very similar, and obviously in a situation where we are desperate, we don't have ventilators, or there is a multiple catastrophe, or we run out of options as our last options. As far as I know, there is no trials already on this system, and as far as I know, has not been tried before on patients. The idea is to present this option just in case you need to use it in the near future. Thank you very much. Hi everybody, this is the second version of the video. We have been working on the lab at King's College Hospital, and my name is Sancho Rodríguez-Villar. We are going to show you how to ventilate 2 ARDS patients using only one ventilator. So we are using a pressure control ventilator, always an injector ventilator. This is a market servo. And as I explained in other videos, what we're going to do is to try to get a tidal volume to split between 2 patients. For that, we have a PEEP of 14, respiratory rate of 24, and very standard parameters for potential ARDS patients. I'm going to pass you with my colleagues who's going to explain you the tube, and after that, the last add we have added in order to increase the safety of the ventilator.
Hi, I'm Jonathan, one of the lead technologists in ICU at King's College. As you can see, we're trying to see if we can ventilate 2 patients using one ventilator. And when we look at our fresh gas tubing, you could see we have 2 bacterial filters over there connected to our inspiratory lane. So these are the 2 inspiratory lanes. The gas goes into the humidifier and then comes out through this inspiratory lane to this patient, and then comes through this again from the chamber, and then comes to this patient as well. So patient expires, it goes through the expiratory lane and comes over here, and then goes out. This patient expires, it comes through this expiratory lane, and then it goes out. So I'm just going to hand you over to my colleague Harvey to explain the rest.
Yeah, so I'm Harvey, I'm one of the technicians here at King's College as well. And effectively what we've done, we've just introduced some gas sampling and spirometry lines into the circuit. So this will be going to one patient, and we split it off to a patient monitor. And as you can see, we're getting tidal volumes of around 397, so effectively 400. And your expired tidal volumes here is around 800. So that's quite good proof that the tidal volumes are splitting fairly equally. And also getting some capillary here as well, just with a gas sampling line. So if we just squeeze one of these bags here, we can represent how if one of the patients is having some issues, it doesn't actually affect the second half of the circuit. So we've got airway pressures here, which is staying fairly regular. Tide volumes may have just jumped up a little bit, but it's compensated already, so back down to 400. Peak's the same, pressure's the same. Got airway waveform here, which has stayed pretty similar. So
that's all. Thank you very much. I hope all over the teams around the world can improve to help with this pandemic.